Over the past 2 years, health service providers, academic institutions and private sector businesses from Scotland, Norway, Finland and Sweden have worked together under the banner of the Competitive Health Services Project, funded by the European Union Northern Periphery Programme. The aim of the project is to identify e-health solutions that have worked in one region of Northern Europe and to transfer these to another region. After a conference in Inverness in 2009, 5 health services were selected to test. In Scotland, we focused on the delivery of teledialysis and speech therapy. Norway piloted the checkup bag, a system designed to record and transmit a variety of physiological assessments from a remote location. Sweden focused on IMO, which is a mobile trailer equipped to carry out diabetic retinopathy and glaucoma examinations. And Finland selected remote wound care, the checkup bag and remote speech therapy. Teledialysis has been in place within the renal service in northern Norway since 2000 and was chosen to trial in northern Scotland because of the distances renal patients and staff travel. Building on the knowledge and expertise from Norway, we introduced a similar service between renal units at Regmore Hospital in Inverness and the Caithness General in Wick in the north of Scotland. This is making a more efficient use of staff time and improving patient care.
The teledialysis project has really allowed us to stop dragging patients from Caithness, 120 miles away, down to Inverness for review, and that's allowed us to free up 4 hours of clinic time. The teledialysis system is used for a whole range of things. We do alternate month reviews of the haemodialysis patients. The non-patient related activity is primarily twice a week, in effect a ward meeting with the nurses from Caithness. And that's actually been very successful. It's improved the already very good working relationship between the two units. We have a schedule of training primarily for the nursing staff here, and prior to that the nursing staff from the satellite unit in Fort William and Caithness and also in the West Isles, if they want to attend that, they have to come here. So since the equipment's been in Caithness, they've been able to be part of the teaching without the travel. And you can imagine travelling for 5 hours to attend a 1 hour teaching session is not, well, it just doesn't happen. I think the patients quite like the technology. I remember the first patient I did a formal consultation with said, "Oh, this is what I do every weekend when I go around to my daughter's and Skype to my grandchildren in New Zealand." But I think they do realise the benefits of it can prevent their travelling down here. Teledialysis has certainly converted me, and I would say I was definitely a cynic at the start of the project. I thought, well, I'd go along and see, and we saw examples of it working in north of Norway, and I've read papers on some of its use in places like Australia and North America, in the more remote parts of Canada. But I was fairly cynical that you could get a good rapport with a patient, but actually you're really not aware that you're having a consultation over the wire rather than actually face to face in reality. And certainly we're looking to expand this to our satellite unit in Fort William, and although it's a different health board, we'd be very keen to look at expanding it to the West Isles, and I would certainly urge any of the health boards that have more remote clinical areas to consider it.
The second pilot chosen in Scotland was speech therapy. We linked with a speech therapist working in northern Scotland and sought ways to try and reduce her time spent travelling. Remote speech therapy has been working in Sweden since 2005. Video conference systems are in place in rural health centres, and mobile units are made available for use in patients' homes. This innovation is made possible through the universal broadband coverage that is available in Sweden, and in northern Scotland we began a limited pilot. One patient in Wick was selected to trial remote therapy and was linked to the specialist speech therapist at the stroke unit in Regmore Hospital in Inverness.
Video conferencing allows much more flexibility in the way we deliver our service, and much more flexibility in the services that can be offered to people, regardless of where they live. Not only in terms of the sort of specialist services, but also in terms of the amount of therapy and how often it's delivered. I've benefited hugely, and my team have benefited hugely from participating in the project. You would think that using video conferencing to deliver therapy would not be as good as the sort of face-to-face interaction. But actually we found, and the evidence from elsewhere has found, that very quickly you forget that you're sort of operating in a virtual environment. And it's also been found that in some ways it's beneficial to the therapeutic process. It's much easier to focus on the session. It's often easier for patients to prepare beforehand for the VC session. Video conferencing, I think, potentially will have a very big impact on the workload that we have and how we deliver the service. A huge amount of our time is spent travelling. Some of the therapists in the team can spend 25% of their time travelling. It also means that people who are living in more remote areas can have access to specialist therapists. Those patients that we have used it with have been very enthusiastic about it. All of them, after a session, after the first session, have thought it was something that they would really like to do again, and probably recognise that it allows them to access the service much more easily and probably more frequently than they were able to access it before. Video conferencing should be part of our working environment. It should be part of the way health services are delivered.
We in the project team are excited by what has been achieved and are seeing the benefits of collaborative working. There is tremendous potential for e-health services to develop further and for the area to become market leaders in e-health, creating jobs and businesses to counter economic downturn. We look forward to many more years of working with our partners. Together, we can make a difference to the people in our regions and to ensure that they have the best healthcare possible in their hospitals, health centres, and maybe even one day in their homes.